Hello, my name is Jacob Avila of 5 Minute Sono, and I have with me a hopefully multiple recurring guest, Peter Weimersheimer. Peter, how you doing, man?
I'm good. How are you?
Awesome, man. Hey, you sent a couple of cases to me, and I wanted to talk about one today. It looks like it's some kind of an echo view, but I was hoping you could walk me through it.
Yeah, this was actually a pediatric case. So this is a
Oh.
7-year-old who um, brought by mom to the ED, had maybe a viral thing about 2 weeks earlier and got better, and then was getting just a little punky. So
Okay.
went to her pediatrician referred her to us, and was really concerned about just having another recurrence of a viral syndrome, maybe getting a little dehydrated, not great affect, not great intake.
Okay.
And kind of an interesting case that, when you walk in the room and just, looked a little gray, just didn't look quite like a healthy kid.
Yeah. All right. So, what ultrasound examination did you start with on this kid?
Well, I actually started looking at his lungs. I was,
Okay.
kind of a question if he had a pneumonia, because here he had a viral virus, and now maybe he's now has secondary pneumonia. So I looked at his lungs, and initially was surprised that he really looked like he was in failure. He had a B pattern in all his
Really?
dependent lung fields.
Yikes.
And then because of that, just took a look at his heart, and because something didn't make sense
Right.
after that, clearly.
Okay. So here are his echo views. And Peter, what are we looking at here?
Well, so the first is the parasternal lung. It's a nice 7-year-old heart, except that there is a little bit of a pericardial effusion around. So there's at a minimum, this young man has a pericarditis.
Right.
And then if you look towards the left, towards the apex, there's something odd about how the myocardium is moving.
Okay.
So concerned that this is not just a pericarditis, but a perimyocarditis. And
Wow.
the next view is the apical forechamber, where you can see definitely some more ventricular dysfunction towards the apex. And ultimately, wound up transferring this kid down to Children's Hospital down south for a possible ECMO and potential heart transplant. The cases that I've had, these kids just crash really quickly.
Yeah.
So literally went from ultrasound on the chest to getting the pediatric intensive care unit involved, to getting a phone call to our nearest children's hospital and getting him in an ambulance, because they decompensate really quickly. So by the time that I saw him, he already had myocardial dysfunction, heart failure, and that can be a pretty rapid decline from that point.
Yeah, of course. Now, it sounds like you kind of did this early on in the patient's course in the ED. Was this ultrasound done before you had any labs back that showed any kind of abnormalities or anything like that?
What labs, you ask? Yeah, no. This is the nice thing about point of care, is you can go and say, boy, something bugs me, get a couple pieces of information and frame your work from that point on. So sure, after that point, all the usual gobbledygook and all the giblets everybody wants to talk about in their rounds. But ultimately, the decision node was, why does this kid look gray, and what's the cause? And as soon as we got that, there was no question of where the endpoint is going to be in terms of management.
Yeah, awesome. Great case. Thanks for sharing, Peter.
Yeah, of course.
Every single day